afternoon. My name is Brianna. I'm a student nurse at Mountain View College, and today I'm going to demonstrate how to put in an NG tube, how to take it out, how to drain an ostomy bag, and how to take it off and replace it. So the first thing I'm going to do is my NG tube. I'm going to check my PCP orders against my care plan. I'm also going to determine if the patient is NPO status, because that will determine if I can offer the patient water during the procedure. Once I've verified all of that, I'm going to gather supplies and go to the patient's room. I'm going to go ahead and come in and provide the patient with privacy. I'm going to go ahead and wash my hands and apply gloves. Good morning, Miss Buzzard. My name is Brianna. I'm a student nurse today. I have doctor's orders to go ahead and put in a feeding tube, an NG tube for you today. Can you go ahead and verify your name and date of birth for me? Okay, perfect. So I'm just going to do a brief assessment on you first. We're going to bring our bed up to a working height, usually to your hip level. We're going to go ahead and bring the patient into a high Fowler position if they can tolerate it. That's going to help get our NG tube down. Okay, Miss Buzzard, so do you have any allergies that I need to be aware of, especially to tape or adhesive, latex? No? Okay, good. And have you ever had sinus or throat surgery? No? Okay. Are you having any sinus issues right now? No? Okay, perfect. All right, well, I'm going to go ahead and do a brief assessment on you. So can you go ahead and hold your nose for me on one side and breathe? Okay, can you do the other side? Okay, good. I'm going to go ahead and also check the nares. We're looking for any lesions, obstructions, if they had a deviated septum for some reason. Next, Miss Buzzard, we're going to go ahead and check your gag reflex. So can you go ahead and cough for me? Okay, and then I would also apply a tongue blade to the back to check her gag reflex. If the patient coughs or reacts, it means that they do have gag reflex. Okay, so now that we've determined which side we want to put it in, we're going to go ahead and do our setup. So you want to make sure that you have a waterproof pad or a towel on the patient. We've determined that my patient is not NPO status, so I'm going to go ahead and have water close by. I'm also going to provide a basin just in case she feels like she needs to vomit anytime during the procedure. Next, I'm going to go ahead and prepare the rest of my supplies. So I'm going to go ahead and get my tape ready. The first piece is going to be about 4 inches long, and it's going to be cut down the center like a piece of pants. This one goes on the patient's nose to hold the tube in place. And the tape would normally be a full inch wide, but I'm having to work with what I have. And then the other piece of tape or a proper clip for the clothing would be the second piece. Next, I'm going to go ahead and get my tubing ready. So I'm going to go ahead and make sure that it's clamped before we get started, just in case we get any backflow from the stomach. Next, I'm going to go ahead and take a look at my tube. Mine actually has markers on it already. If it didn't have markers, I would also cut another piece of tape to determine how long the tube needs to be. Then I would properly measure it on my patient. You would start with the patient's nose. You would go to their earlobe, and then their xiphoid process would be proper placement, and I would mark the spot, and I would document what placement that's going to be. Okay, Miss Buzzard, so we are about ready to start the procedure. You would go ahead and lubricate the tube 4 inches. Okay, Miss Buzzard, so before we get started, just know that if at any point during the procedure you are in pain or uncomfortable, to go ahead and raise your hand for me. There is water nearby. You can take small sips as we go through. I'm going to go ahead and advance the tube with your head leaned back, and then at some point I'm going to ask you to put your chin on your chest and swallow for me, and that will help me guide it the rest of the way, okay? So once you're ready to start, you would ask the patient to hyperextend their neck. Okay, Miss Buzzard, ready? We go ahead and put this in until we feel resistance. Okay, if you can go ahead and put your chin to your chest for me. And then you're going to advance the tube smoothly down to the point that you've marked on your tubing. Okay, Miss Buzzard, are you doing okay? Okay, good. And then you're going to go ahead and put the tape on. And you want to make a sling with the tape around the nares. You want to make sure that it's placed in a way that the patient can still breathe through their nose. Okay? And Miss Buzzard, I'm going to go ahead and tape this to your clothes. You want to make sure that you leave enough room in the tubing for her to move around. Okay, so just be aware of that. It is attached to your gown, so if you have any issues where you need to take it off, just call me and I'll help you. So I go ahead and remove my gloves and perform hand hygiene. I would go ahead and clean up and then do any documentation that's needed. Miss Buzzard, I'm going to be back in just a few minutes. They're going to have to take you to have an x-ray done to make sure that we've placed your tube correctly before we start your feeding, okay? I would make sure the patient was comfortable, assess if they need to have anything else before I leave the room, have the bed in the lowest position, have a call light close by. And Miss Buzzard, they should come get you in about 30 minutes. I'll be back to check on you. If you need anything in the meantime though, just hit that call light and I'll come right in, okay? So I would go ahead and do any more documentation once I leave the patient's room. Okay, now we're going to go ahead and we have orders to have the NG tube taken out. So I'm going to go ahead and verify my PCP orders with my care plan. I'm going to determine again whether my patient is NPO or not. I'm going to go ahead and gather any supplies that I need. I would come into the patient's room, provide privacy, wash my hands, apply gloves. Hello, Miss Buzzard. My name is Brianna Blackburn. I am your student nurse today. We have doctor's orders to go ahead and take out your NG tube. Can you go ahead and verify your name and date of birth for me? Okay, perfect. And do you have any allergies that I need to be aware of, especially to latex or tape? No? Okay, perfect. All right, so now we just get ready to do the procedure. So you're going to put the patient's bed up to working height again. You're going to bring them up into a high Fowler position as long as it's tolerated. You're going to put a waterproof pad or a towel on the patient's chest. My patient is not NPO, so I'm going to make sure that I have water close by and a basin in case they are going to throw up. Okay, Miss Buzzard. So I'm going to go ahead and start removing your tape here. And if at any point during the procedure you're uncomfortable, you just need to raise your hand for me. And we'll go ahead and stop. So you have some water here. You can take some sips of water. I'm just going to go ahead and pull out your tube. And we'll try to do it as quickly and smoothly as possible. You just let me know if you have any problems. So I would make sure that my tubing is not hooked up to any kind of feeding. If it was, I would discontinue it. I would flush the tube and have it clamped. In this case, it's already been stopped from the feeding, so I would just flush it if it needs to be flushed, and I would clamp the tube before we got started. Okay, Miss Buzzard, are you ready? Now, I'm just going to need you to take a deep breath and hold it for me, okay? And you would quickly and smoothly take the tube out. And it's out. You would go ahead and provide the patient any kind of oral hygiene or clean up anywhere around the tube. There can be stuff left on it from down in the stomach. So you just want to make sure the patient's able to blow their nose and that they're comfortable and cleaned up when the procedure's over. You would go ahead and remove everything. I would go ahead and remove my gloves and wash my hands. You would make sure that the bed was in the lowest position. And Miss Buzzard, is there anything else I can do for you before I leave? Okay, good. Well, your call light is right here close by. Just call me if you need anything, and I will be back in about 30 minutes to check on you, okay? So once you've got your bed in your lowest position, you've washed your hands, you've documented everything, and made sure the patient was comfortable, you would go ahead and leave the room. Next, I'm going to go ahead and set up for an ostomy, so give me one moment. Okay, and mine's going to be placed here on the counter. I know it's a little bit hard to see. Okay, so First thing I would do before I did any ostomy care was check my PCP orders against my care plan, just to verify everything and check to see if my patient is NPO. Once I have all of that verified, I'm going to go ahead and gather supplies and go to the patient's room. So we're just going to pretend that this is on there already. So you would come in, you would provide privacy for the patient. I would go ahead and wash my hands and apply gloves. Good morning, Mr. Buzzard. I'm Brianna, I'm your student nurse today. I'm here to go ahead and assess your ostomy bag. Can you verify your name and date of birth for me? Okay, perfect. And do you have any allergies that I need to be aware of? No? Okay. So first thing we're going to do is assess whether the bag needs to be drained before we get started with anything. So in the case of this, you would just go ahead and place a waterproof pad underneath the bag, or you can get the patient to get up and go to the restroom if they are ambulatory. And you would go ahead and empty the bag. You would go ahead and clean it first, and then you would re-clamp, take your gloves off, and perform hand hygiene. So we're going to assume we've already done that procedure and the doctor's ordered to have it replaced. So we're going to perform hand hygiene and maintain standard precautions. We've already verified our patient with the name and date of birth and allergies. So now we're going to start by removing it first. You want to gather all of your supplies before you get started. You want to go ahead and have a waterproof pad underneath the ostomy bag just in case there's any leakage during the procedure. I'm just going to go ahead and have that placed. I'm going to move this up just a little bit just to make sure it doesn't slide off. Okay, so we're all ready to go. We're all gloved up. We're ready to start the procedure. So the first thing we're going to do is remove the bag. So you're going to go ahead and you're going to pull the patient's skin back. You would peel off the bag. You would dispose of it per facility policy. And then you would immediately go ahead and remove your gloves and perform hand hygiene. After that, we're going to go ahead and clean up the stoma site. So you would reapply, you just washed your hands, so you would reapply gloves. You would go ahead and clean around the stoma with soap and water. You do not want to use alcohol or anything else because it can dry it out and cause irritation. Once it's clean, I'm going to go ahead and assess the stoma. We're going to make sure that it is pink, that it's moist, so it doesn't look like it's having any infection or abnormal discharge. After that, we're going to go ahead, once we're done cleaning, and remove our gloves. We're going to perform hand hygiene again, and we're going to apply new gloves. You can put a piece of gauze over the stoma while you continue the process, just in case there's any leakage out of it. Next, we're going to go ahead and use our measurement device, and we're going to measure the stoma. Once we figured out our size, you want it to be about 1/16 bigger than the stoma. And you would go ahead and place it on your new wafer and determine how big it needs to be. You would cut out the size that you would want and make sure all the edges are smooth before you get started. So ours is a 2-piece system, so once we've cut that out, we would go ahead and peel off the sticky. You would place it over the stoma and make sure that it's sealed. You can place your hand over the adhesive to make sure that it sticks well. Once we've got it placed, we go ahead and apply our bag. The patient can have a say as far as which position that they want it facing in, but you do want it facing in a downwards position in some way, just so gravity can keep all of that stool pointing down. So once it's attached, I would make sure that it is clamped off, and you would slightly tug on the bag just to make sure that it's secure. Once that's done, you would go ahead and remove your gloves and perform hand hygiene. And then lastly, you would move the patient's bed back down into the lowest position, make sure the call light is closed, ask them if they need anything, and then you would go document the procedure, how the patient did during the procedure, what the stool contents looked like, just so that the doctor can know and have everything documented. But that's it. That's how you would place an NG tube, take it out, assess the stoma, clean out the bag, and replace the bag.